When communicating with a patient who has a hearing impairment, which of the following is the most appropriate approach? So option A says to write down important information. And that sounds good because then you don't have to worry if for you or the patient to think, oh, did I misunderstand? Did I mishear what was being said to me? They'll always have it written down to refer back to, and they could also look at it when they're at home again, and they get a peace of mind that what they're looking at is accurate and that they don't have to depend on the fact if maybe they misunderstood something. What's also important to note about this answer choice that's important is that it's saying writing down important information. Note, it's not saying something like write down the whole conversation. Like you're not going back and forth with the patient. You write down something, they write down something, and then handing back and forth, because that can be really difficult on you and the patient, and that could be very time consuming. If something like that was needed, like if this patient was deaf and didn't hear at all, you might want to consider if they use some sort of sign language interpretation. However, this is just saying about writing down important information, which is appropriate. So we will probably go with option A. But let's take a look at the other choices in case something is a better fit, because this question does say most appropriate, meaning that there might be other choices that are appropriate, but some might be more so than others. So option B is saying use hand gestures and facial expressions. Now, something to consider with this is that saying hand gestures, it's not saying that you're using sign language. Let's say this patient is someone that communicates in sign language and there's a sign language interpreter, or you know sign language and you're using it with the patient. That's different than this. It's saying hand gestures. That's kind of like if you talk with your hands or you're motioning towards something. That wouldn't be the most appropriate approach, even though it could be helpful, because something could get lost in mistranslation. You might think that you're explaining it one way, but it's not really a universally understood way of communicating. If you're using just certain gestures, that they might think you're saying one thing when you're saying something else, as opposed to an option A, if it's written down and there's really no way for it to be misinterpreted because you're giving it to them written down exactly what you're meaning to say, not kind of gesturing your hands in a way where they're trying to guess what you're trying to say. So that's the difference between options A and B, and why option A would be more appropriate than option B. So we will eliminate option B. Let's look at the other choices and come back to option A if this still looks most appropriate. So option C says speak louder and faster, and that's actually a misconception that, oh, if I speak a lot louder, maybe in some cases, but if a patient is truly deaf, then speaking much louder is not really going to be any more helpful. If they can't hear you, they can't hear you. And speaking faster here, that would not be appropriate because that would make it even more difficult for them to follow. Maybe if it said louder and slower, that might be more appropriate. But so far, option A is looking a lot better than these other choices, so I'll eliminate option C. And then option D says avoid direct eye contact, but you actually would want to maintain eye contact when you're communicating. So out of all these choices, it's looking like option A would be the most appropriate choice, which is what the question's asking, the most appropriate approach in this scenario.